Today I'm here to talk to you about hypothyroidism. Are you tired all the time? Do you have chronic hair loss? Do you have unexplained weight gain, or are you having difficulty losing weight? These are all symptoms that would lead me to think about looking for a thyroid issue. So do you know that of 10% of women have a thyroid issue, and if you were in a room of 50 women, at least 5 of them would probably be suffering from something related to their thyroid. And when it comes to hypothyroidism, there are 2 main reasons why someone becomes hypothyroid. One is that you might be suffering from an autoimmune condition called Hashimoto's thyroiditis. Or secondly, the thyroid, sometimes from chronic stress or burnout, starts to just take up the slack and work harder, and you can look like you are hypothyroid, but actually it's more likely an adrenal issue. So let's talk about treatment. As a naturopathic physician, I tend to have a very unique approach to treating conditions, and today we'll talk about how I would approach hypothyroidism. Firstly, I am a doctor, and the first thing is that it's important to look at blood work to rule in and out hypothyroidism. In my case, though, I tend to do a more extensive blood work than probably your average doctor would be. I look at TSH, free T3, free T4, sometimes reverse T3, and also thyroid antibodies. Secondly, I'm a naturopath or functional medicine practitioner, which means I'm always looking at the underlying cause. This might be with regard to thyroid because of chronic stress. It could be because you have an exposure to a chronic virus like Epstein-Barr. It might be because you're eating something inflammatory like gluten, or have a nutrient deficiency like vitamin D or iron. It could be because you have an overgrowth in your gut of a bacteria, a parasite, or a fungi. And lastly, especially in Hong Kong, which is really important, it might be because of toxicity. But usually it is a combo of one of these things that is causing the hypothyroid issue. And it's really essential to look at all of them to come up with the best plan going forward. Thirdly, I am also a homeopath, which means that I always give a homeopathic remedy to stimulate the body to heal itself. This 3-prong approach is very unique and holistic, and I believe gives the best clinical outcomes. So please go ahead and share this video if you think that anyone you know or your loved ones would benefit from hearing from it. And if you yourself have any concerns or support, please contact IMI. Thank you very much for listening today.